There's been a few different studies now. The top two were performed in the States, the bottom two were performed in the UK, with rates of being very overweight and overweight, somewhere between around 10 and 50%, depending on what figures you're looking at. Rates of obesity, we typically talk in horses now around 40 to 50% in the UK, which is obviously pretty alarming. This was a study that came out of the Royal Veterinary College recently in your neck of the woods, which actually looked specifically at ponies within a 50 mile, if I remember rightly, radius of the Royal Veterinary College, and they actually found 70% of those ponies were severely overweight. So that's a higher figure than I guess you might expect in the pony population. But really quite alarming that 70% of ponies are now overweight to a level that we'd be concerned about their health. So I was just going to pull out some of the figures from two of those UK studies, not that one from the Royal Veterinary College, but one from the University of Nottingham and one from the University of Glasgow, both of which looked at body condition scoring in horses. And the first of those studies looked at 160 horses and looked at how researchers scored those horses and then how owners scored their horses. There are two important take-home messages. One, that 54% of the researchers classified horses as overweight. So 54% of the horses were overweight according to the researchers. So the rate was high. The other point is that there was a big difference between the rate of being overweight according to the researchers and according to the owners. So 21% of owners thought their animals were overweight, whereas 54% of the researchers thought their animals were overweight. So there's clearly a big difference in how trained researchers will assess body condition and how owners will assess body condition. Second study was a bigger study over a smaller number of premises, 319 horses. They did a similar thing. Researchers looked at the animals and then owners looked at the animals, and figures were pretty similar. Around half of the horses were overweight according to the researchers, but only 30% of those horses were overweight according to their owners. So clearly there is a difference in how owners see body condition and how trained animal health researchers assess body condition. So take-home messages: 1 in 3, probably 2 in 3 UK horses are overweight, and that owners are not always the best judges of their horse's condition, and they certainly judge body condition differently to trained researchers. And that's also true in the human population as well. We realize that horse owners rarely recognize moderate weight gain. We're often slow to recognize moderate weight gain in ourselves, hence the reason we use scales as well as just looking at ourselves in the mirror. It's also well recognized that parents are not very good at recognizing obesity in their children. Interestingly, grandparents are quite good at recognizing obesity, but those parents that are very close to their children, and there are clearly analogies to those of us that are very close to our horses, we don't tend to recognize those gradual increases in body weight. And relevant to us as vets, doctors will only recognize, or will certainly only comment on obesity in 50% of children. So there are parallels, and there's a lot we can learn from what's going on in the human field. We know that our pets are often surrogates for our children, not necessarily surrogates. A lot of us have pets and children, and often treat them in a similar way and become very bonded to them. And they are often treated in a very similar manner. There is a desire to love and to be loved by both our children and our pets, and there are strong psychological needs for those of us that have animals to be loved by our pet. And to be seen to be loved by our pet. And eating and feeding are often ways of spoiling our children and our pets, and therefore receiving positive feedback for ourselves, which we find gratifying. So there is an important psychological aspect to eating and feeding, both in children and in our domestic animals. Eating and feeding often means of coping with stress, both amongst ourselves, and also we can then pass that on to our animals. And we're all pretty stressed out at the moment, so there can be a tendency to feed more as well as to eat more. We hear all sorts of things as vets, and that's pretty heavy, so this is a little bit more light-hearted. We hear all sorts of things as vet, and I'm going to see whether Ryan's heard any of these expressions from a horse owners, that he's just a good-doing type, he's not obese, he's not overweight, he's just a good doer. Well, there isn't really a difference. You're burying your head in the sand. Your horse is overweight. He eats nothing. Well, you can tell us that, but we don't believe it. The only way that horses get overweight is by eating too much. And the important thing is to realize what is too much. He lives on fresh air. She lives on fresh air. Now, yes, there is clearly an element of truth in that quite often, in that a lot of our native species have a far, far lower nutritional requirement than we actually think they do. We end up feeding them far too much. When we actually analyze how much they need to maintain their body condition, it's far, far less than most of us perceive to be an acceptable or a normal amount to feed a horse. He puts on weight when he just looks at the grass. Well, that's also a problem, because many of our natives have have evolved to live on pretty sparse pasture, and when they live on the grass that we often put them on, they will gain weight. So clearly they are eating it as well as looking at it, but they don't need to eat a huge amount of it to maintain body condition or to gain body condition. It would be cruel to feed them any less. And an important barrier that we'll touch on at the end in the psychological aspects of weight loss picks up on that psychological relationship between us and our pets, and the importance of feeding those things that are important to us. And people do struggle to feed horses less because they perceive it to be cruel. Clearly, the opposite is true. It's cruel to allow your animal to become obese and for its welfare to suffer. But it can be very, very hard to deal with that, and deal with the fact that we should be denying our animals food when they want food. So all these things that we as vets hear quite often are all signs, sadly, that we're kind of in denial about body weight. If you catch yourself saying any of those things, then you probably have to accept that your horse is tending towards being overweight if it's not overweight already. So why are our horses obese? Well, in pretty simple terms, a lot of our domestic horses are cold-blooded native types, evolved to live on pretty sparse, barren pasture, such as that Welsh mountain. We don't put them on pasture like that typically. We tend to keep them on pastures that have traditionally been used for agriculture, and are therefore very, very rich, very lush, and very good at producing animals that gain weight. And horses just were not evolved for that. Similar in donkeys. Thanks to Donkey Sanctuary for giving me these pictures. Donkeys developed in very arid climates, as most horses did ultimately, way back when. We put them on dairy grass, other lush pasture, and clearly they're not accustomed to that, so they're going to gain significant amounts of weight. So in a normal situation, in the wild, where horses are not mollycoddled through the winter, they will progressively gain weight through the summer. And as they gain weight, there is an evolutionary advantage to them for their endocrine function to change, and they develop what we call insulin resistance, which I'm sure is a thing many of you will have heard of, particularly those of you that have got ponies with laminitis. So they gain weight, they become insulin resistant. That insulin resistance actually helps their metabolism through the winter when they've got less supply of calories, and they're better equipped to maintain body condition when they get less nutrition through the winter. And as they lose weight over the winter, their insulin sensitivity then returns to normal. So their endocrine function goes through this annual cycle as they gain weight through the summer and then they lose weight through the winter. Of course, what happens in the domestic situation is that they don't lose weight through the winter because we look after them as only seems right and proper. We put rugs on them, we feed them more, we try and maintain their body weight through the winter because that's what we feel is the right thing to do. But there's an ever-increasing understanding that horses really do need to go through this cycle of gaining weight through the summer and losing weight through the winter. And we shouldn't try and superimpose what we want to do for feeding through the winter on that natural cycle of weight loss. And an important aspect of that is a changing perspective on how we look at our horses, how we keep our horses, what we do with our horses. So traditionally, horses were bred for work. And most of them worked quite hard, whether it was under saddle or whether it was pulling carts. Increasingly, though, horses are domestic pets. Not all, and obviously there are sweeping generalizations here. But typically, the horses that we keep, we're very fond of, we look after very well, and we don't expect them to do huge amounts of work. Even if we exercise them, the demands that are placed on them are far, far less than traditionally horses have become used to. So increasingly, horses are companions rather than beasts of burden. And along with that has become a change in perception over what horses should look like. So I don't want to get involved in anything political, but the picture on the left shows a horse out hunting. The picture on the right shows a show hunter. And they're obviously very different in their condition. And our perception of what a hunter, just by way of example, and obviously there are other examples, our perception of what horses should look like has obviously changed considerably as our expectations of them for work have diminished and as they've become more companions in our lives. And that's not been good, because the change in perception now is towards a horse that carries considerably, possibly 10, 15, even 20% more body weight, and therefore a huge amount of extra body fat. So this was a genuine case. I did a client evening in Wales quite a few years ago when I was talking about obesity, and someone came to me at the end and they kindly shared these pictures with me. This was a pony that was a really successful show pony. And some people look at this pony and see something beautiful. This pony performed very well in the show ring. Others would look at this pony and see something that's really not quite so beautiful. And I'll move quickly on before I get into trouble for showing non-PC photographs. But I just want to make the point that it is all about our perception of what is beautiful. And that's very different to different people. And this pony did really well in the show ring when it was carrying a lot of weight, but it was suffering with recurrent laminitis as a result of that obesity. And then as soon as the owner managed its weight, sorted its laminitis, had it in a much leaner body condition, it ceased to do well in the show ring. So there are clearly issues with a distortion of perception of what horses should look like and what a healthy body condition is for a horse. And that raises difficult political questions as to whether we should be rewarding essentially obese, diseased horses in the show ring. And obviously this comes up for discussion, and there's a lot of good work being done to address this, and all the right people are involved in those discussions. But it has become an increasing problem that our perception of what horses should look like has changed dramatically. And obviously that filters down to every horse owner. So why am I banging on about the health problems with obesity? Well, they are many. The biggest one, the one we were going to focus a little bit on tonight, is laminitis. But there are many other health problems. I think Ryan talked about this the other week, and no doubt mentioned that there are links between obesity and arthritis, and carrying greater body weight is a problem in itself for those animals that suffer with arthritis. Obese animals will have a lower immunity. That's in the focus of all of our minds at the moment with what's going on. There's a syndrome of inflammaging, where inflammation is associated with advanced age, and that will be hastened in obese animals. Obese animals are potentially less fertile. This can be a problem even before animals are born. If mares are obese, then their unborn foals are more likely to suffer from joint disease later in life. There are problems such as hyperlipemia, which is an endocrine metabolic problem in horses, and particularly ponies and donkeys that are carrying too much fat, where they can start to have too much fat in their bloodstream, which causes them to go into multiple organ failure and is frequently fatal. Colic can be a problem. The evidence is a little mixed, but I think most of us that see a lot of colic cases would accept that animals that carry a large amount of body fat are more likely to develop these fatty lumps within their abdomen that can wrap around the intestine and can cause potentially fatal colic lesions. And there are studies that suggest an association between obesity and bad behavior in horses. And then also, importantly, arguably not necessarily a health problem, but it's a big problem to horse owners, horses that are carrying a lot more weight, potentially 20% more body weight, clearly are not going to perform as well as horses that are 20% lighter. Unless, of course, they're in the show ring, and then they need to carry that weight because it's all about aesthetics rather than athleticism. So laminitis is the big one, and that's the one I really wanted to focus on, because this is the one that most frequently kills horses as a consequence of obesity. Laminitis is a common problem, sadly, far more common than it should be. It's typically a preventable disease, yet studies would suggest that up to 7% of horses have laminitis each year. That won't always be detected because it's often what we call subclinical. So the horses are suffering from it, but we don't necessarily see it manifest as lameness, so we don't necessarily realise it's there. That estimate gets higher for native types. It may be as high as 13%, so more than 1 in 10 native types getting laminitis every year. And you'll see from that table there that laminitis is up there on as one of the top reasons for euthanasia of older horses. This was a study that was performed out of Liverpool, looking at horses in the Northwest and the Midlands. Laminitis was five on the list of reasons for euthanizing older horses. And if you look at those above in the list, they're not specific diseases. You've got lameness, colic, chronic illness, and acute illness. So they're all collections of diseases. So laminitis as a standalone condition, albeit arguably a bit of a syndrome in itself, is the standout disease that is responsible for the death of older horses. The estimate there being it kills 1 in 10 horses over 15 years. So this is a huge welfare problem. Most of these cases have a hormonal explanation. Equine metabolic syndrome, which is essentially obesity in simple terms, is responsible for the vast majority of them. A smaller number will be associated with pituitary pars intermedia dysfunction, otherwise known as Cushing's disease. Often though, I think Cushing's disease hides underlying equine metabolic syndrome and obesity, and often it's the obesity that is responsible for the laminitis. And the Cushing's disease is often contributing to that, but obesity is fundamental to the vast majority of cases of laminitis. And this is, I don't say this as a criticism, but unfortunately, and well, if I do say it as a criticism, it's probably of my profession that we haven't got the message out there. Unfortunately, there's a poor understanding of the issues of obesity and laminitis among owners, and a general lack of appreciation of the gravity of the situation of obesity and the severity of laminitis and the degree of suffering that it's associated with. It's also tricky to recognise the early clinical signs of laminitis, which presents us with a problem. And often horses will grumble on with laminitis that's undetected until the clinical signs become really severe. So that can be a contributory factor in losing horses as a consequence of laminitis. So we all really need to raise our game and be more proactive at trying to identify the early signs of laminitis, probably performing more routine x-rays to detect the changes that we wouldn't otherwise see. This was a study that I on earlier. This was the study from near the Royal Veterinary College where they looked at native ponies, and this just pointed out that the risk of laminitis native obese pony population is really, really very high, and it's a massive cause of loss of native pony. So it's often said now that obesity is the biggest threat to equine welfare in the UK. I don't think many people dispute that, and it's because of this link with laminitis. So obesity, laminitis, equine metabolic syndrome, the terminology gets really confusing. This is a flow chart that's outdated now, and believe it or not, it's simplified. I don't want to go into it in any, but I just want to make the point that equine metabolic syndrome is a complex endocrine syndrome that has obesity at its heart. Obesity isn't just the process of laying down fat. Fat tissue, adipose tissue, is very active as an endocrine organ in its own right. It's not just a storage organ. So the fat cells that are laid down when animals are fed excess calories produce what we call DipECEIMs, which are hormones from fat tissue, and they have a number of different metabolic effects. And central to that is a reduction in the effect of insulin. And if insulin is not working as well as it should, then the pancreas is forced to produce more insulin. Therefore, horses have increased circulating levels of insulin in their bloodstream, and that increased circulating level of insulin causes damage to the feet, which causes laminitis. So it is a complex syndrome, and it's similar to type 2 diabetes in people, and therefore human metabolic syndrome. But fat tissue is not just a storage organ, it's pumping out these active hormones. These hormones affect the response to insulin. More insulin gets produced, insulin damages the feet, causes laminitis. Other features that are associated with equine metabolic syndrome, less of a concern from a welfare point of view, but you will also see higher blood pressure, same as people, and also altered reproductive cycling, again, same as people. So we're essentially talking about a condition where horses carry too much weight, particularly, obviously we see it around the eyes, we see it in the nuchal crest, down the neck, we see it around the mammary gland, around the sheath. Often owners think there's a problem with the sheath, but it can just be fat tissue, and the same around a mare's mammary glands. And ultimately, this fat tissue changes the metabolism, and that causes damage to the feet. And from those pictures there in the centre, at the top, you can see the chronic external changes of laminitis with poor hoof growth, affected by increased insulin levels circulating. And apologies for anyone that's squeamish, but the picture at the bottom, you can see when it goes catastrophically wrong, the bone in the horse's foot actually pulls away from the horse's hoof, separates, and we get catastrophic laminitis with the bone, the pedal bone, essentially falling through the bottom of the foot, which is just a hideous condition, and invariably results in euthanasia, sadly often after quite a long period of suffering. So it's a harsh reality that equine metabolic syndrome, obesity, are an avoidable disease caused by dietary mismanagement, to be fair, of animals with a predisposition to the disease. So there are some breeds of horses that their metabolism is such that they're unlikely to get equine metabolic syndrome and laminitis. There are other breeds, the native breeds, those more thrifty breeds, that are far, far more likely to get it. So there are types that are particularly hard to manage, but we can't get away from the fact that it is our management that is ultimately tipping them over the edge into developing health problems associated with obesity. So how do we assess obesity? I just want to give you a bit of an overview of what we do, and I'm hoping that you guys will be sufficiently inspired to seek more information, pick up with your vets, with Ryan and his team after this, and seek more information. I haven't got time tonight, without boring the socks off all of you, to go into all the details. So a bit of an overview on assessing obesity. Obviously, the best way is to weigh the horse, and there are more and more portable weigh bridges around that can go to yards. Fantastic if you've got them available, but they are quite cumbersome and they're not available to everyone. So that's the best way of assessing obesity, is to assess body weight. Body condition scoring, though, is really useful, really important. It's not that subtle for very obese horses, but we look at fat in different areas of the body, particularly through the neck, in front of the shoulder, along the ribs, along the back, over the rump, and then around the tail head. And I'll pick up at the end of the talk on some guides that you can get to teach you how to do that, or again, your vets can help you do that. It doesn't take a huge amount of skill to be able to body condition score reasonably well. A bit more skill to become seriously proficient at it, but it's very, very achievable for everyone to do. This is a really nice guide, actually, that World Health Welfare produced. There'll be a link to that at the end of the talk, and I'm quite happy to share all these links with anyone that wants them at the end. And that talks you through exactly how to body condition score your horses, and it's well worth getting into the habit of doing that. There are other measurements we can take that are perhaps a little easier, a bit more objective. We can look at neck circumference, literally measuring around the neck. We can look at heart girth, which is taking a measurement around the body at the level of the heart. We can look at belly girth, which is taking a measurement around the fattest point of the belly, or the largest point of the belly. And we can also look at rump width from hip to hip, simply taking measurements with a tape measure and keeping tabs on that as time goes on. So for heart girth, as the horse is breathing out, just put a tape measure around the points of the elbow and just behind the end of the withers. And this is exactly the same place where you would use a weigh tape, as I'm sure many of you are accustomed to doing. Belly girth, we just essentially go at the widest point, which is usually about 2/3 of the way back between the shoulder and the hip, as the horse is breathing out. Quite a useful little tip, which someone taught me, if you're prepared to, and you can always do it under the belly, is just to put a little line in with some clippers where you've taken the measurement, to make sure you're taking these measurements in the same place every time, so that you're consistent. Neck circumference is probably a little bit less helpful. The nuchal crest is quite slow to change. It contains like fibrous tissue as well as fat tissue, but halfway down the neck, we can measure neck circumference and assess obesity that way. And then finally, we can look at rump width, which is simply a measurement from the 2 points of the hip right over the top. What's really useful and really important, I think, particularly if you're on a weight loss program, is to record these measurements and to take them regularly and to make it part of your routine. Potentially every Saturday, or every second Saturday, every first Saturday in the month, whatever works for you. Make it part of your routine to assess your horse's body condition, and have a chart that you can actually use to record all these measurements. And a lot of practice will have them, or you can find them on the internet. We can get a bit more technical, and we often will. If horses are suffering from severe metabolic changes and are at risk of laminitis, we can actually look at what's going on with their metabolism. Fundamentally, we do that by looking at insulin levels. We can also look at insulin responses, so we can see what insulin levels do after feeding typically, or after a sugar challenge. That's something we quite increasingly like to do. There was a phase of looking at adipokines, which are these active hormones that come out of fat tissue. The one that had the most evidence to support it and became the most popular was adiponectin. It's currently difficult to get hold of a test for adiponectin, so that's become more challenging to do. And there are limitations with measuring those adipokines. So insulin still remains the main one that we look at. And these measurements can, both adiponectin and insulin, can give us a fairly crude indication of laminitis risk. So they are a way that has limitations, but they are a way of looking into the future and determining which animals are most likely to get laminitis. But we have to do that with caution, and ultimately argue that it doesn't change a great deal. If the animal's overweight, then potentially it's at risk of laminitis, and we should be doing something about it, regardless of what its lab tests tell us. So we've touched on how we evaluate obesity, and I could go into it in a lot more detail, and it would be well worth you picking up on that afterwards. I was then going to look really at how we manage obesity, and I assume most of the people listening are listening because they've got concerns over their horses being overweight. Essentially, in simple terms, I think we need to reevaluate how our horses should look, and I've touched on the issues we've got of perception of horses' body condition, and the fact we often perceive they're in a healthy body condition when actually they're in an overweight body condition. So I think it's helpful to get some outside involvement in doing that. Reevaluate how your horse should look and how it looks at the moment. Then work with your vets that know your horse the best to determine a target weight where you want to get the horse to. Then you need to take complete control of your horse's diet. And that can be challenging if there are lots of different people involved in the management, and can also be challenging if it's recommended that the horse needs to come off pasture for a period of time if it is more severely overweight, because we never like to pull them off pasture, but sometimes that can be necessary. It's important to weigh horses' feed when we're on a weight loss program rather than just guesstimate, because we will cheat, and that's not a criticism, that's just psychology. There's lots of evidence, particularly in the human field, looking at childhood obesity, that we will always sneak a little bit more food in, and over time we sneak a bit more and a bit more and a bit more, and suddenly we're feeding an awful lot more than we should be. So we need to be very objective about how we do this. And then stick to the plan. It's very easy to set off with good intentions and then fall by the wayside. You just have to try and stick with it, and I'll give you some tips on how you can do that as we go through. And then I sort of tag this in as number 6 of our 5-point plan, because it is such a problem that other horse owners who have a different perception of body weight can really undermine your efforts at your horse's weight loss program. Others that are less well informed and think horses should carry a lot more weight than they really should will often undermine people's really good intentions at promoting weight loss in their horses and getting them into a more healthy condition. So sometimes you've got to be quite thick-skinned and ignore the helpful comments you get from other people in the environment where your horse is living. Listen to your vet, listen to your farrier, listen to those that are knowledgeable about what your horse really should look like, and ignore sometimes some of the less helpful comments. So, getting into the nitty-gritty, we need to manage feeding, and if we've got a horse that's clearly obese, we ideally want to get 1% of body weight loss per week until we get to our target weight. And clearly to do that, we need to manage feed intake precisely and take complete control. Going hand in hand with that, we almost certainly need to limit access to grazing. Horses, and particularly ponies, will easily take in their daily requirements within 3 to 6 hours. So if we turn them out for 12 hours, say, then that can be 2 or even 4 times what they need per day. So they're going to continue to gain weight. And left to their own devices, horses will typically eat 2 or 3 times what they require to maintain their body condition. So if we have one of those more susceptible native types, then we cannot just feed them ad lib. They are going to gain weight. Exercise obviously offsets some of the effects of feeding in burning calories. Typically, we're looking to trot horses for 30 plus minutes per day. Obviously, if we're battling laminitis, that becomes more challenging. Less rugs is helpful. Again, if horses are a little bit colder, they're going to burn more calories. Over rugging is a big problem, so we should be looking to use far less rugs. And then finally, medicines possibly are helpful for managing obesity. In the majority of cases, they won't be necessary, but in horses that have not improved over a 30-day period or so, in those horses that have laminitis that prevents exercise, or in those horses that we really do need a quicker route to success, given their underlying health problems, adjunctive medicines can be quite helpful, and they've been demonstrated both in the equine and the human literature to be really quite effective in managing obesity. So to pick up on those 5 points in turn and go into them in a little bit more detail, the first point of management was feeding. So I would work with your vet, but obviously there are other nutritionists available to develop a feeding plan. I think your vet can give you a really good holistic view of everything, and they will also consider that every horse is different, and they will hopefully tailor a feeding plan that works for you and your horse. And it has to be something that's practical for you to do and works with your management and with your yard structure. So I'm not just going to give you a magic diet for every horse for inducing weight loss, because that wouldn't work for every horse. You do need to get a tailored plan and work with professionals to get there. But roughly speaking, having just said that, we're going to be feeding 1 to 2%. 1 is pretty light. There's very few that are going to be being fed that little. 1 to 2% of the horse's body weight in food per day, assuming the horse is not being turned out. So that's really quite a small amount. That's often a third, even a quarter of what a lot of horse owners are feeding daily. So you may be quite shocked by how little you have to feed for a horse just to maintain its body weight and not gain body weight. Forage analysis is really helpful. It's really inexpensive and it's really underutilized. If you're feeding a consistent batch of hay, particularly through the winter, then it's well worth getting that analysed. That can really help with developing an accurate diet plan. Something that's becoming increasingly popular is feeding a 50% straw diet. People often throw their hands up in horror at that idea. Straw is actually really good food for horses. It's fermented in the hindgut. It's not that calorific, but it gives them a nice source of fibre, which is fundamentally what they're designed to eat. And there's more and more studies showing that it's safe and effective to introduce a large quantity of straw into the diet. And most horses, unless they're doing large amounts of work, only really need forage and a balancer. Now, there's obviously a massive equine nutrition industry producing 101, 1,001, million and one probably different feeds for every different situation. The vast majority of horses do not need any supplementary feeding. They need forage and they need a vitamin mineral balancer to compensate for any vitamin mineral deficiencies there may be in the forage. If you've had forage analysis done and it's all encompassing, you may not even need a balancer, but it's typically recommended that we feed a balancer just to make sure that horses don't get any deficiencies. But they don't need supplementary feed as a source of protein or energy. So that, in a nutshell, that was feeding. Limiting grazing is never popular. We all want to see our horses turned out and expressing normal behavior. Often there's a compromise to be had. If we're going to limit their intake, we often need to think about ways of turning them out on non-grass areas, whether it's concrete yards, whether it's wood chip paddocks, whether it's areas of mud that have been sprayed off. There are different ways of achieving it, whether it's just turn out in the school. That's clearly better than stabling horses the whole time. Turning them out on grass is a real problem if we're trying to get weight loss in horses that really need to lose weight quickly. It's a problem because the sugar content of grass varies massively, so it's very, very difficult for us to estimate what their calorie intake is. And some sugars, the sugar content of some grass can be up there with some hard feeds, which would horrify most people. You wouldn't give a horse ad lib access to pony nuts, which essentially is what you can be doing if you're turning them out on good grass. If you are turning them out on pasture, there are some situations that are better than others. Native grasses are better. Avoid dairy grasses, rye grasses. Shady areas are better. And if you are looking at hay and haylage, just consider how that's being prepared. I haven't got time to go into detail about that, but you can prepare hay and haylage in such a way that reduces its calorie content. Turning out sheep can be quite useful because they can eat a lot of the grass and reduce the amount of grass that's out there. Turning out overnight can be better because there's less calories in the grass overnight because of the balance between photosynthesis and respiration. Just beware though, sunny, cold weather, the sugar content can get quite high, even though we don't perceive it to be high when it's cold. Now, again, I haven't got time to go into detail, but there are more and more clever systems out there for trying to encourage horses to move around and eat less. So different track systems, and the like. We need a bit more science behind them. There's a bit more work being done. They do have some limitations potentially, particularly with herd dynamics and equine behavior, but they can work really well in some situations. Excuse me. Grazing muzzles are another option. Some people hate them. Some people find they work really well. It depends a little bit on your horse, but you do need to be careful how you use them and which ones you use. And again, I won't go into huge amounts of detail, but there's a really nice guide, which I think I'm going to show you in a second, from the National Equine Welfare Council on how to use grazing muzzles safely and humanely. Just think a little bit about your pasture management. I'm grateful to Nikki Jarvis for giving me this photograph. A lot of people strip graze, and this just highlights the potential issues with strip grazing. Strip grazing can very easily become intermittent ad lib feeding. So just be very careful about how you strip graze. The amount of grazing that horses need, particularly these types of horses, is really, really very small. And there's more and more data on pasture management out there. So again, seek advice on the best means of pasture management. So often though, really, and I'm grateful to 2 different equine charities for giving me these pictures, the only way for horses that really struggle with obesity and laminitis, the only way is not necessarily for all of the time, but for a large period of their turnout, is to give them access to some non-grass area of turnout. So both of these charities are using wood chip paddocks, so they can completely control their dietary intake. This was the leaflet I mentioned, which is available online, www.nuke.co.uk, about how to use grazing muzzles safely and humanely. So if you are using grazing muzzles or thinking about it, then it's well worth reading this guide. So limiting grazing, obviously we can just keep horses in stables more often. We don't want to do that, but if we are doing that, it can be a necessary evil. People often worry about stabling horses and restricting their food intake overnight. They're concerned that it causes gastric ulceration. That's not the case. Horses do want access to food as regularly as possible through the day, but they don't typically eat a great deal overnight unless they've been fasted through the day. So don't feel you're doing your horse a disservice by depriving it of forage through the night. And when they are in the stable, spread food through the day as much as possible, small regular feeds, feed balls to slow down their rate of eating, small weave nets, triple nets, hanging the hay net in the centre of the stable. There are all sorts of different tricks to try and prolong the amount of time the horses spend eating. This is quite a nice one from one of the equine charities. I'm grateful. This was a DIY job, a great big beach ball inside a hay net with a hay stuffed around it, just to give the horse a little bit more environmental enrichment and also prolong the amount of time that it spends feeding. Another good tip, again, this is from Red Wing, so thanks to Nikki Jarvis. If you are weighing out forage content for the day, don't weigh it out 4 times a day or twice a day. Do the whole job in one go, and then split it into the hay nets for the day. So weigh the daily ration, then split it up into the number of feeds that you're going to give. There is an inevitable tendency to cheat. So if we cheat 4 times a day, we're going to feed a lot more than if we just cheat a little bit once a day. Now, clearly we'd rather not cheat, but if we're going to, then it's much better to just do it once. This is a picture from Bransby, I'm grateful to them, of a system they've developed of feeding straw and mixed with hay often, and using these nets over the top of feeders when you're dealing with a group of horses. So that's a clever way of enriching their environment, allowing them to eat for longer periods of time whilst maintaining their intake. Exercise was the 3rd thing we talked about. And I think it's important we talk about exercise and not talk about work. This comes back to the perception thing. If we talk about work, it doesn't really sound very appealing. If we talk about exercise, hopefully it sounds a bit more appealing. So if we talk about exercising our horses rather than working our horses, hopefully we're a bit more inclined to do it. Most horses love exercising. As they get bigger, it may become more of a problem. And if their fetus sore becomes more of a problem, we get a vicious circle. But if we can keep them lean and fit, they will enjoy exercise, as we hopefully will. And then it's good for everybody. Try and make exercise a social event. Try and ride out with other people that are in a similar position to yourself. Try and be disciplined about it. Obviously, it's more motivating if you're riding out with somebody else. And the aim is 30 to 60 minutes, 5 days per week. And that's a very broad brush and a sweeping generalization. Again, get some more specific advice on that. But that's a sort of rule of thumb if we're going to have any significant effect on body weight. So the 4th point we talked about for encouraging weight loss was less rugs. Horses are not humans. Sounds obvious, but we often think it's cold. Horse must be cold. Not true. Horses thermoregulate very differently from how we do. They're adapted to cope with much bigger temperature variations than we can cope with. There's more science out there to demonstrate that horses would much prefer to live out in a shelter than be in a stable or be rugged. And again, that's a sweeping generalization. But most horses, given the option, would really rather not wear rugs. They would much rather take shelter from wind and rain, which they find particularly noxious. Low temperatures they can cope with extremely well. So looking at the data that's out there, we don't really need to think about rugging most horses until it gets down to 5 degrees C, which is only marginally above freezing point, obviously. So much better off to consider not rugging horses, to give them shelter. If it's really wet and really windy, they are more likely to require a rug because they are less well capable of withstanding wind and wet because it gets in under their coat. But if they're acclimatized, they can thermoregulate even down to as low as -10 degrees C, and they don't need any rugs even down to that temperature. So clearly we can't do this overnight, but we all have a tendency to over-rug our horses considerably. They would generally speaking, be much, much happier wearing less rugs less of the time. There is good data to demonstrate that. So the final thing we talked about with managing obesity and being overweight are medical adjuncts. And this is a little bit controversial because in theory, we shouldn't need any medical assistance for managing obesity. We know obesity is a management problem, and therefore we should be able to address it purely with management and with reducing feed intake. The reality is, though, often life isn't that straightforward, and there is good data from human medicine that indicates that obesity and health is often managed more effectively if adjunctive pharmaceuticals are used. So we have two options really in equine medicine. The first is metformin. The second one will be levothyroxine. But if metformin is the older one, so I'll talk about that one first. Metformin is a drug that was used for treating diabetes in people, and it was used to reduce insulin responses. And as we said earlier on, high insulin levels are central to equine metabolic syndrome and responsible for inducing the laminitis. So it's logical that we would use metformin to try and reduce insulin levels. The difficulty, though, is it's not very well absorbed in horses and doesn't appear to work nearly as well in horses. It does, however, reduce glucose levels, so it does have an effect by reducing calorie intake, but it only does that for a limited period of time, and it can therefore only have a pretty limited effect. It is no substitute for a proper diet. If you are using it to offset feeding horses too much, then you're cruising for a bruising. It's not going to work very well. The only time you might use it is just to take the edge off laminitis risk around periods when you perceive horses are more likely to go down with laminitis, but quite honestly, it'd be far better not to expose the horse to that level of risk in the first place. So it's a drug that's become less and less popular, and it's not really a drug for managing obesity. It's more of a drug for just taking the edge off laminitis risk. There's nothing licensed in horses. We either use human drugs or we can use specials paste manufactured specifically for horses. But even though we have a lot of experience using the drug now, there's nothing official and licensed for horses. So the second drug, which has become more popular recently in the UK, it's been used in the US and Australia for some time, but until recently it wasn't available as an affordable preparation in the UK. The second drug is levothyroxine. And levothyroxine is just thyroid hormone. And fat horses don't have low thyroid levels, they're not hypothyroid. But we discovered some years ago that by raising the level of thyroid hormone, they will metabolize more fat and they will therefore lose weight. That's fairly fundamental endocrinology. And raising the metabolic rate generally can help burn fat. Anyone that's suffered with thyroid problems will be well familiar with this. It also has the beneficial effect of increasing responses to insulin, which is helpful because it therefore reduces the amount of insulin and therefore reduces laminitis risk. We used to be concerned about safety with levothyroxine. It doesn't sound right to be giving a horse thyroid hormone, but there's more and more safety data out there. The amount that we give is pretty small. And there's one study that's looked at horses that are on thyroid hormone for up to a year and not found any health problems. And another study recently that gave them 10 times the dose that we would normally use for managing obesity and again, didn't find any health problems. So we've become more and more comfortable with using levothyroxine and the fact that it's safe to use. So typically we would administer levothyroxine, vets would administer levothyroxine to horses until they reach their target weight. So you have to do it alongside dietary management. It's not an instead of situation. This is just a way of hastening the response to dietary management and making it more effective and for tackling those horses that just don't respond to dietary management on its own. Typically, we used to say we'd use it for 3 to 6 months to reach that target weight. Increasingly, though, vets are using it for shorter periods of time just to get things going on the right track, to minimize laminitis risk in the shorter term, to start that process of weight loss. And then if it's not affordable to keep the drug going because it is expensive, then increasingly we're finding that shorter treatment period is helpful just to get the ball rolling. It's important if you're using thyroid hormone that you have regular vet checks, and regular doesn't necessarily need to be any more than once a month or once every 2 months. But this is a really effective drug for promoting weight loss. And it is important that you check in with your vet, even if it's remotely, particularly with everything that's going on at the moment. This can be via this sort of forum with photographs, with video consultations. Just check in with your vet over changes in body weight, body condition, and potentially, obviously can't do this remotely, but potentially look at markers of adiposity and insulin dysregulation, so lab tests essentially, but that's less imperative. Ultimately, we're being governed by the condition of the horse. So yeah, levothyroxine is expensive, but it is highly effective for promoting weight loss, and there's more and more data out there to show it's useful for animals with obesity and that suffer from recurrent laminitis. And whilst it is expensive, it's a lot less expensive, and it's far, far better for the horse than recurrent bouts of laminitis. Just like metformin, though, there's no official licensed preparation for horses in the UK. Again, we're using medicines that are formulated specifically for horses, but aren't actually licensed for use in horses. There are all sorts of supplements, and I'm sure there'll be questions that come in about supplements and nutraceuticals. I can't say a huge amount about them because there isn't really any science to talk about. Lots of people will swear blind that different things are helpful. We have very little information in the equine sphere, so we can look at what's going on in human medicine, and things like chromium, cinnamon, L-carnitine, oligosaccharides are all talked about as being helpful for promoting weight loss, but the human evidence suggests they really don't do anything. So I would not be looking to spend my money on supplements for promoting weight loss. I would be saving a large amount of money by feeding considerably less. So that all sounds fairly easy in theory. But as we touched upon at the start, there's a really important psychological aspect to obesity, whether it's with children, whether it's with ourselves, whether it's with our pets. And there is an element of addiction to the psychological codependence of feeding our loved ones and receiving a positive reinforcement from their positive reaction to our feeding. And we suffer negative effects of feed withdrawal in our children or in our pets. So this can be hard for us psychologically to do this. There are little things that can help. Weighing food to make it more objective. There's a scenario called withdrawal indecision, where we're just tempted to be a bit indecisive about exactly how much food, and we just give a little bit more. So if we're objective about it, if we weigh everything, that overcomes that psychological tendency. Using smaller bowls and scoops, again, can make us feel like we're feeding more, and it worries us less to see a small amount of food in a small bowl compared to a small amount of food in a massive bowl. So just little things that make it easier to cope with the psychological difficulties of dieting our horses. This sounds really harsh, but if we depleasurize meals for horses, make them higher in fiber, make them less palatable, then the horse derives less pleasure from eating them, and that cycle of positive reinforcement over feeding becomes less pronounced. Obviously, we've got to go through that phase to get to that stage, so that's quite tough. But in the long term, it can make life easier. We probably need to go through that because those are the kinds of feeds that we should be feeding if we're going to promote weight loss. And they even in human medicine, they even talk about learned techniques of breathing control to control the stress of depriving children from feeding. And I think that just I'm not suggesting we all go out and learn breathing control, but I think that just makes the point how difficult it can be psychologically to diet our kids and our pets. I think fundamentally you need a buddy to go through this with. You don't want to be doing this on your own. Whether it's someone else at the yard that's going through the same thing, and bearing in mind there'll be lots of people in the yard that are telling you you're being cruel to your horse because you're starving it, you need moral support in doing this, both from friends on the yard and also from professionals. So your vets, your farriers who you'll see every 6 weeks, just get some support on this journey to make it easier along the way. And just to touch on the fact that don't feel like you're failing if you need to resort to medications. We don't want to resort to medications unless we have to, but the human studies do demonstrate that there is an adjunctive benefit to using them. So if you're doing this and not speaking to your vet, then it might be worth speaking to your vet about everything holistically, but including the possibility of using medicines to help things along the way. Only for a short time period though, and only for those that need it. And yeah, join a fat club. Lots of people go to Weight Watchers and the like. I'm sure there's others available. I don't want to promote one organisation, but more and more veterinary practices are running fat clubs, or they have more politically correct terms for them than fat club. But these are ways of getting horse owners with overweight horses together to work together, overcoming the psychological barriers. Regular weigh-ins performed by the practice help you assess progress, make it all more objective, make it a lot more enjoyable. Give you a lot more professional support to review feeding plans as things go through and allow you to discuss changes in management. They allow you to check feet regularly, pick up on those subtle signs of laminitis, which we're always fearful of in obese horses, and potentially, and it's not always necessary, but potentially allow you the opportunity to see what's going on at a metabolic level and assess endocrine function, whether it's looking at insulin levels or sugar challenge tests. or measuring adiponectin. There are different options out there that allow you to assess progress. And it allows your vets to pick up on those horses that are truly weight loss resistant. And I'm not going to go into this in any great detail, but there are some horses that, despite doing everything right, they just don't lose weight. And they are particularly challenging metabolically. And those horses need a little bit of extra help with some veterinary intervention using the medicines that we discussed. Which ties into achieving, just discussing the use of levothyroxine with those animals that have weight loss resistance. So, just to summarise, we've all forgotten really what horses should look like. We've got into a position now where 50% of UK horses are overweight or obese, 70% of native breeds up to are overweight or obese. That's the figure from the home counties from within 50 miles of the Royal Veterinary College. We know that 70% of laminitis cases are due to obesity, and we know that obesity causes many other health problems in addition to laminitis. It's just laminitis is the big killer. The remaining 30% of laminitis cases probably have Cushing's, but often they've got a metabolic component as well. So it's not often that vets are telling you to spend less money, but on this subject, we really would encourage you to spend far less money on feeding, and in doing so, make your horse far healthier. Think very carefully about how you turn your horse out. Think very carefully about what you feed and seek advice on what you feed. And this applies to everyone, not just animals with obese horses, because you want to maintain them in a healthy condition and not start down the slippery slope towards obesity. And if you are struggling with horses that you're aware, or you might have fessed up to yourself silently tonight that you're in denial about the body condition of your horse, then speak to your vets for a tailored plan. Act early. No one's going to be upset about discussing this with you, even if your horse is only tending towards being overweight rather than being morbidly obese. The sooner we can act, the better, the more likely we are to prevent laminitis. So if you are in any way concerned, speak to your vet. Now's a great time to do it. A lot of this can be done remotely. So speak to them. Do be wary of other sources of advice. I've said a few times about the sort of advice you will receive for other horse owners when you're embarking on programs of weight loss, because of the issues with perception of what horses should look like. So so seek professional advice and above all, stay strong as you go through the process, because it is difficult. So further information, I can send this to Ryan. He can send it around you guys if you haven't got time to scribble it all down. But essentially, if you go onto the BVA website, the British Equine Veterinary Association, BVA have pulled together a number of different resources for horse owners on managing obesity, because this is such a massive problem. So if you Google BVA obesity horse owner, you'll get to the right page. And a number of resources and guidance there that you can look at. There's a body condition scoring chart that Red Wings have produced. There's that new grazing muzzle guidance. There's the World Horse Welfare weight assessment guide, which is really useful. A similar thing from the Blue Cross, giving more general advice on getting horses to lose weight. There is a fantastic guide by the Horse Trust and the University of Liverpool, which is a little booklet that gives you the whole gambit of advice on managing obesity. That is really, really useful. It's called When the Grass is Greener. Then again, there's the World Horse Welfare Monitoring Condition Sheet. I said it's really important to monitor. And similarly, there's a weight tracker there as well. So a lot of the tools that we've talked about through this talk are there on the BVA website. But if you only look at one thing, I would urge you to Google and find from that BVA website this document, When the Grass is Greener, produced by the University of Liverpool and the Horse Trust, which is a fantastic horse owner guide to managing equine weight. So yeah, I urge you towards that, and I'm